A very good afternoon to you, sir, and thank you very much for joining us. What do you perceive is behind these high numbers of not only infections but deaths in the industry?
I think we regret the deaths of all South Africans, not just the healthcare professionals. But given the scarcity of our human resources in healthcare, it is more profound when we lose people in the front line, particularly younger healthcare professionals. You know, we've all had this issue of over 60s, but there's been a significant number of healthcare professionals that are under 60 that have demised from COVID.
And some of the driving factors behind the high infections in the early stages, we saw that PPE was problematic, with health practitioners not being able to access some of the most basic needs for them to do their jobs.
Yeah, the PPE story is quite sad, particularly when it becomes clearly apparent that it's not a lack of resources, it's just a lack of morality and ethics where there are challenges with PPE. But there's much more than PPE that makes healthcare professionals at risk. The inadequacy of human resources, the long working hours, the lack of rest, and the shift system that is really consuming on professionals is an area for concern. If you have to work for 24 hours on end, or for long hours on end, your alertness, your tiredness compromises your safety and the safety of those that you have to serve.
What does this speak to, that we do not have enough healthcare practitioners in the system, and hence we see that people are rotated highly and you have to work these extra long hours?
Well, it speaks to the fact that we do not have a national health system. Part of the sad thing about South Africa is that even though in the public sector we had a scarcity of human resources, particularly doctors, we had lots of GPs that were idling, that were without work at the height of the pandemic. So if we had a national health system where we utilize all healthcare resources that reside in South Africa, irrespective of which sector they sit in, and we had a national health system that was overarching above all sectors, public and private, would have had a more efficient use of the human resources available and would have created a far safer working environment, not only for the healthcare professionals, but also for the public that we serve.
When you say we do not have a national health system, if you could please just elaborate further for us, what do you mean?
What I mean is we don't have one system where we utilize all resources that we have. We have more than 5,000 general practitioners that were underutilized during this pandemic. We have lots of specialists that sit in the private sector that could have been brought in into the public sector. We even have specialists in the public sector that are doing moonlight work with the permission of the employer in the private sector. So all these inefficiencies in an incoherent health system contribute to the challenges that we face. So if we had a system where it was, as they propose, a single payer, where all of us work for all South Africans, irrespective of which sector, and that people can access whoever practitioner or system that is accessible to them. Whichever sector is closest to you has to be part of the national health system.
And this was on the part of whom? The practitioners or government?
This is on the part of all of us as South Africans. We're still a divided society, and all of us yearn to have a medical aid rather than yearn to have a healthcare system that works properly and equally for all of us. It is time, as South Africans, we take responsibility for our inhumaneness as citizens, our indifference to the fellow citizen that is challenged, and not blame anything on the state. We get the government that we deserve as a people.
We get the government that we deserve as a people. Much has been said about NHS, and some people believing, well, I don't think it's going to work for me on the part of some of the healthcare professionals that you talk about who were not brought onto the system, who could have very easily helped, believing that perhaps the system in South Africa is not proper enough for us to get to that point. How would you assess that? Is there a point to be made there?
I think you've put it properly when you started, that it is not for me. And that's the problem. It's the selfishness of South Africans that's put us in the predicament that we have. Nobody says it's not for us. Everybody says it's not for me. If it's not for you, who is it for? If we don't work as a collective, what do we hope to achieve? And that is precisely the point. You know, you can't say it's not for you, and you sit in a family where you're the only one that has medical aid, and your granny who brought you up, your father, your siblings don't have medical aid, and you say it's not for me. What are you saying about your own people? What are you saying about your own humanity? It's time we came to the party. And remember, if we work collectively, this will work. When you have systems for the poor, it will be a poor system. When you have systems for the rich, it will be a wasteful system. And that's exactly what we have in this country. If we have a system for all, it will be incumbent upon all of us to make it work.
Sure.
If a poor person has to go to where I go for my care, where the president of the country has to go for their care, that's the only way we can uplift the quality of care that they would receive.
A country like Ghana, for instance, they have the NHS, and some argue that it's working very well for them. We've seen examples where it's worked on the continent, but they're also saying that, you know, there are some problems with the system. How do we then ensure, because there is a point to be made from what you were saying, but how do we then ensure that the system runs effectively?
You see, people have short memories. When I started in the healthcare system, there was a wide public healthcare system that was second to none in the world. And it worked on the principle that we advocate, where it was for no payment to the users. And it was a high quality healthcare system, second to none in the world. It's a system that gave the world the first heart transplant. It was a public system, largely financed on taxes, and the users never had to pay. So we've done it in this country. We don't have to look at Ghana. We have to look at what was wide preserved not so long ago. Redo it, but do it for all who live in this country.
Doc, you have to admit, though, that a lot has deteriorated in terms of where we are as a country. A lot of things don't work, and that is an honest fact. You go to public healthcare facilities, it's a shame, like you say. You will say, well, no, you've got medical aid, but your grandmother doesn't have medical aid, or your uncle doesn't have medical aid. But when you go to public healthcare facilities in South Africa, it is a shame. So I guess the question of how do we make sure that it is proper speaks to also the deterioration that we have seen over the years.
You see, that's precisely the point, that me and you sit here and say the public health sector doesn't work. How can it work when the privileged like me and you are not a part of it? This is apartheid revisited. You know, we lamented and we fought apartheid because there was a system for whites that was superior to a system for others. And we wanted a system for all. Instead, the privileged others have joined the system that was just for whites, and it has now been privatized. It is not private, it is privatized, because it runs, that private system is dependent on an act of parliament that divides society. So let us not act surprised when we have a Medical Schemes Act, which is an act of parliament that separates the rich from the poor, and that is the cornerstone of apartheid in health. Now that we've crossed the bridge to join the other side, what used to be white care, we are not the ones to now start saying, oh, look at public health care. We should be saying, oh, look at ourselves. The majority still remain outside in South Africa. It's no longer just based on the color of your skin. It's about whether you have or you have not.
Sure. It's definitely about whether you have or whether you have not. So you keep talking about how it is up to you and I. So what does you and I do?
I think you and I, and maybe you'll give me an opportunity, you and I need to work together to ensure that this heinous crime against humanity called the Medical Schemes Act is abolished with immediate effect. That's where you and me, the parliamentarians, the judges, and the cabinet go for our healthcare. And we've left the majority of South Africans outside. It's time we became frank and spoke freely, openly, and truthfully. That those that have in this country don't care about those that don't have. And as Nelson Mandela warned us, this is far worse than the apartheid that we fought.
It's been such a pleasure being in conversation with you this afternoon. Dr. Kgosi Letlape, President of the Health Professions Council of South Africa, with some very challenging thoughts there. Thank you very much.